tell us a little bit about why you feel like it's so important that women are having those regular kind of GYN pelvic health visits.
Well, so there's a couple of reasons. One, obviously, is the pap smear, but it's interesting because I've had a couple of patients recently who had not seen their gynecologist after they had their last baby. And their last baby
And
was
their
like
baby will be
10
25
years.
years
Yeah,
old.
exactly. Right. So 10, 15 years ago. And they were like, well, I think I need to, or I'm busy taking care of all the
Yeah.
kids and my
Mhm.
husband, whatever.
Mhm.
So their health takes a back seat. So they're
Mhm.
not thinking about those things.
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited to be joined by Dr. Whitney West. Dr. West is a board certified obstetrician and gynecologist who has delivered her fair share of babies and is no longer doing any obstetrics, now fully gynecology. Is that right, Dr. West?
That's correct.
All right, tell us a little bit about you. Where'd you train and where are
Mm.
you at now practicing?
So I am currently in Madison, Alabama, which is right near Huntsville, Alabama. It's a suburb. And I've been here almost, now 25 years. I'm originally from Philadelphia. I went to Meharry Medical College in Nashville, Tennessee for medical school. And I went back home to Philadelphia to do my residency training at the University of Pennsylvania.
Okay, very cool.
Yeah.
Well, we're happy to have you back in Alabama, and I want to talk about your practices, and I'm going to say practices plural because
Hmm.
you got two, and I want to absolutely spend a little bit of time talking about those. But first, I'm excited to have you on as a gynecologist. I am a family medicine doc, and just by way of my training, do some GYN care in my office, but very often have to rely on my gynecology friends to help me out with some gynecologic issues or concerns that my patients may have. And so I'm taking just as many notes as I know the listeners are today and wanted to just get into some questions. Are you okay with that?
Absolutely.
All right, well, let's start off. And these questions will kind of base just on your gynecology practice and your years of experience. But if there was something that just to start this conversation off, something that you wish women knew about pap smears. I spend so much time talking to women about pap smears, and I get that look that comes over people's face when I initially say it. But pap smears are so important. We're recording this at the beginning of February, just came out of Cervical Cancer Awareness Month. Tell us what you wish, Dr. West, that more women understood about pap smears, just what pap smears are screening for, why we do them, and what you wish women knew about them.
Well, thank you for asking me to talk here today, and thank you for having me. I appreciate the opportunity to share this information because I think women's health in general is not talked about enough,
Yeah.
and that's one of the biggest problems. So, as a family practitioner, I am happy as a gynecologist to take your patients for the ones you think are complicated, right? Just send them on. Um, there's no reason for you to try to manage those. That's what we train for. So I'm absolutely happy to take referrals from family practitioners to do paps and abnormal paps and that kind of thing. But what a pap smear is screening for cervical cancer. It's just screening. So we're taking just the surface layer cells and we're sending it off. And what that does, it gives us information regarding those patients who need to have further, more detailed testing because there's something abnormal.
Mm-hmm.
And abnormal doesn't always mean cancer. So abnormal can just
Right.
mean abnormal cells that haven't progressed to the point that need any kind of treatment. How I usually explain it to my patients is it's three levels: mild, moderate, and severe. Severe is precancerous. Anything over mild requires some kind of management. And there's a couple of ways we can do that. But mild can stay mild for decades. I mean, it takes a long time for it to turn into something that requires some kind of management, surgical management, or something like that. The biggest problem is that people think that if they've had a PAP, they don't need another one. And there's a lot of
Yes.
confusion around the screening guidelines and,
Mhm.
with HPV testing and what is that, and as opposed to the PAP itself. So the PAP test itself is not HPV testing. And the
Mhm.
HPV testing is, if it's negative, you're good for about 2 years. And that's um, two reasons. One, insurance won't cover it for less than that, right? So, unfortunately, we do a lot of our management based off of what insurance will cover. But two, also, we know that unless something's changed in your lifestyle, like your sexual partner, or if you've had infections, anything like that, um, then you're unlikely to have any changes in about a 2 to 3 year window. So we don't technically need to repeat the HPV testing. Now, if it's positive, then you absolutely need follow up. And that's where people kind of go, I say, awry, because maybe they've had testing and they don't know what the results are. And
Mhm.
maybe it was abnormal, or maybe it was questionable and they needed some kind of follow up and they haven't gotten it. Now it's years have gone by, and now they're in a different situation, or they've had a couple of partners since that last time, and exposure is different, and there's so many variables to that. So it's really important to maintain your relationship with the doc who's doing your annual exam, and I mean annual for GYN. So because physicals are different than PAPs, pelvic exams.
Right, absolutely. And I'll have women, just what you just said, women who will come to me as a new patient and they'll say, "Oh, Dr. Anderson, I'm up to date on my pap smear. I got one 2 years ago." And I'll say, "Oh, so everything was normal in that pap smear?" And more
But
times than not, I'll get I don't
I
know.
don't know.
Well, if everything was normal, then you're right. You're up to date at 2 years. But if something was abnormal, then there's a possibility that you may need another pap smear, right now. And so important. And that's a lot of what we kind of get into on this show, just taking some ownership of our medical history, right? I think that's so important to know, to not take oh, well, no one called me back, so I assume everything is fine. Call the office. Say, "Hey, what did that pap smear look like? Was everything fine?" And then put it somewhere, right? So write it down. That way, if something does happen and you have to transfer to another office, you still got that medical information there with you. And when you're changing offices, request to have your information sent to the
Absolutely.
new office
Mhm.
also. I think those things are so important. And
Yes.
so,
Yeah, I think it's very important. And there's medical journals out there now where you can actually write down your info, or you can even put in the folder, like if there's a folder in there. I think, don't you have a medical journal?
yeah, I was
Yes.
wondering if that was a plug there for me, Dr. West. So I'm going to take that opportunity to say, ladies, if you have not gotten your 2026 Healthier Planner, be sure to get one. And this discussion is literally why I included it there. It's so often that I get new patients and I'll say, "Oh, have you had any surgeries?" And they're like, "Yeah, I had my gallbladder taken out." And I say, "Okay, when?" And crickets.
I
No,
have no
no
idea.
idea. And so I love this planner as just a way to track your health history. And that's helpful to us, to me and you as the physicians, but it's also at the end of the day so beneficial for patients to be able to track that too. So thank you for that plug, Dr. West. I love
Oh,
it.
you're welcome.
Yeah, and as this airs, we're not too late into 2026. I've still got some in my living room, so I'm so happy to get those out. And so, Dr. West, I know that you have a special interest in PCOS, right?
Mhm.
And that you, in your gynecology-based practice, see a lot of women who have fibroids or who have PCOS who maybe come to you and say, I know I have this diagnosis, or I think I have this diagnosis, but I have so many questions or have concerns about how it's been managed or not managed in the past. Talk to us a little bit about those kind of two. I grouped them together, but they're certainly two different things, but I put them together in my head as buckets because I feel like those two things are the things that women so commonly will have as a diagnosis, but have questions around them or have concerns about their treatment plan.
So the pro I will agree with you on everything you just said. There are so many women who come in with either a self-diagnosis or misdiagnoses, because Dr. Google's out there, and chat and Gemini and all those are out there helping folks make their own diagnoses. So the biggest problem, I believe, is that, first of all, a lot of these women are African American, and a lot of times, we're just not being heard. So as we sit here in February 2026, you and I both are African American females, and I know you've had situations where you felt like you weren't being heard in whatever situation it was. Yeah. Even as a physician, patients, it's harder for them because, one, they don't have the background knowledge, and two, right, some of them don't feel like they have a voice because, right, I feel like we live in a somewhat patriarchal society. So what the doctors looked at as, the father figure, and, so, and then they'll say, oh, don't worry about it, oh, or whatever, or just kind of blow them off. Don't even listen to the symptoms at all. So I've had to come in and let's recheck labs. Let's redo an ultrasound. Right. Let's talk about your lifestyle, like your nutrition and that kind of stuff. So there's been a lot of patients who I've had to, I'll call it talk off the ledge, because they're like, I know something's wrong and nobody's listening. And I said, I'm listening. Let's figure out what we do next. And, everybody's management is going to be different. But yeah, it is a huge issue. Like I said, a lot of people, and I'll tell you, the other problem too is that the reasons for these conditions, one of the reasons for these conditions is what we are being fed as far as nutrition or the lack thereof. So a lot of patients are eating things that artificial sweeteners and ultra processed foods, and their nutrition status itself is not up to par, and that kind of throws their body into a whole another issue. So we have to talk a lot about lifestyle modifications when it comes to these conditions.
Absolutely. And I love that you brought up Dr. Google and Dr. Chat GPT and Dr. Claude and all these things, because you have kind of, maybe we'll group people into two different categories, right? Maybe there's a third category out there, but you have the women who come in who have convinced themselves that they have a certain diagnosis. And then you have yet other women who are truly having kind of some symptoms, some signs and symptoms that they think are normal, and they normalize those things and don't get their checkup done, don't get their pelvic exam done. So this podcast is not about giving specific medical advice, but if there are women who are out there who are having some gynecologic symptoms, are there any symptoms that you say, hey, if you're having this going on, don't normalize it, seek, either go see a primary doc, go see a gynecologist, or kind of where do you fall with that?
So there are a couple. One is no period, and you're not pregnant, right? And it's been a long time. Like it's been, you haven't had a period in 2 years, right? Irregular bleeding or prolonged heavy bleeding, because then it turns into anemia, and then now we're talking about a lot of other issues that happen, stemming from this prolonged heavy bleeding, because you should not be wearing overnight pads for 2 weeks out of the month. Like that's not normal. It may be normal for you think, but it's not normal for a regular period. Anytime you have bleeding after you stopped having a period. So if you're menopausal and you have postmenopausal bleeding, that is not normal, and you need to be seen right away because there's a risk for cancer. So you definitely have to. And then the other thing is severe pain, abdominal bloating, like your belly's growing, that kind of thing. So, things like ovarian cancer, there are no screening tests for that, but you can have symptoms that mimic other things, like your belly's getting bigger and you're not doing anything different. So most women, know their bodies, and they know when something's wrong. Even if they're ignoring it, they know that something's not right. So definitely go to be seen and be evaluated and ask questions.
Absolutely. The ask questions, that's so important. And the knowing your body, right? And not just knowing your body, but believing that you know your body. And so often I'll say, if you go somewhere and you get one answer here, but you still know something isn't right, seek another answer. Just at least, if two or three, now five, but six people tell you the same thing, okay. But not just to let loose with one person saying one thing, and then you taking that when you know that something doesn't feel right. And we think about what that one thing is. And I hope that I'm not guilty of this, but I know many physicians are. So I don't want to not lump myself in that category because I may be. But that is sometimes this thought of, oh, well, it's just a part of getting older, right? And we sometimes hear that from our family members. As women, we hear it from our moms and our aunts and our grandmothers. Maybe sometimes people hear it from their doctor as well. But just getting older isn't a diagnosis. All right. It's just a part of getting older, isn't a diagnosis. As women, our bodies change. And so we get into, for some of us, our late 30s, our 40s, our 50s, and we start to notice those changes in our bodies that have so much to do with, hormones, with thyroid health, with metabolic issues. And I know that that's something that often may come up in the primary care office, but I can imagine that even more often it comes up in your gynecology office. Tell us what that discussion is like when you are seeing women that are having hormonal changes, but they think that it's, quote unquote, normal or just something that's going to happen.
Well, so what happens, I think a lot of times, is that they end up with me after they have seen their primary care doc, and they haven't gotten either answers or results from what they have been sent for. So you have a woman who comes in with your typical perimenopausal symptoms, and everybody doesn't get hot flashes and night sweats, right? So you get brain fog and confusion and concentration issues, or there's problem with your bladder, like you're peeing more at night, or joint pain, or tingling. And this is the one that got me: tingling in the shoulder blade, right? Just weird symptoms that you're like, or ringing in your ears. A lot of those are because of hormonal changes, being perimenopausal or menopausal. And the difference between perimenopause and menopause is that you actually have stopped your period for 12 months. And perimenopausal means that you're probably having period irregularity. Now, if you've had a hysterectomy, that's going to confuse the issue. So
Absolutely.
that's a whole nother topic. We can talk 30 minutes just on that itself. But I think a lot of women it's been ingrained in their brain that they just have to suffer through. Like, we'll get past it. It'll be over at some point, because that's what our mothers or grandmothers did, or said to us, oh, it'll be fine. Don't worry about it. And I say, why are we trudging through this when
there's no gold star?
Right. Exactly. That's kind of how I feel. I felt about having a baby and getting an epidural. I was like, this already been proven. I need my pain medicine. So no, but seriously, there are a lot of women who feel like it's just, and not because necessarily a doctor has said this, but because in conversation with, either their friends, or if they've heard a parent, or the parent didn't say anything. Like their elders never said anything, and I just watched her from afar, and she just, she looked miserable. It was kind of funny because my dad said my mom went through menopause for at least a decade. She was going through the change for like a decade, and I know he was talking about her mood, because her mood was off sometimes, So she was a little cranky, but yeah. So we like, again, it is about either how we've grown up or what has been put in front of us. And only recently has the idea of having conversations about being menopausal, or your cycle changing, or whatever, you having symptoms that just don't feel right, it's okay to talk about. I think that's been in the last, I'm gonna say maybe 5 to 10 years. It's not even
Yeah, really recent.
really recent. Yeah. So, and I always tell patients, every decade your cycle is going to change. Um, so we need to be mindful of that. But in the midst of that, do pay attention to what the changes that are happening and when those changes are happening, what else they're associated with, because it's not just your female hormones that could be abnormal. We're talking about your thyroid could be off, because some of the symptoms that you get from thyroid dysfunction look like female hormone dysfunction. Then you've got the stress hormone, the cortisol issue, and if you're stressed out and how you're not sleeping and, all of that kind of stuff. So all of those kind of play a huge role. And then we have to talk about sugar and insulin regulation. And when that is off, like you're craving certain things, or if you're not eating right or you're eating, poorly, then you'll have certain symptoms as well. So fatigue and, that kind of, and you'll get that with all of these things. So
Right.
it just depends, on your entire picture, not just one particular symptom that you have.
Absolutely. And I know that that is so much of the discussion that you're having with women in your gynecology practice, but then also in your integrative medicine practice. So I mentioned at the top of the episode that you've got two practices, and I don't want to be saying that wrong. Tell us a little bit about kind of the how you separate the two things that you do in your clinic space.
So the GYN practice is a typical insurance-based GYN practice where I do obviously just routine stuff like birth control and pap smears and fibroid management and that kind of thing. And then those people who want to go a step further, my cash-based practice, Essential Health and Wellness, PC, is integrative where we discuss lifestyle changes and nutrition. I have actually a nutrition and exercise coach that I'm working with. And then so we come up with programs for patients, and that it's what's not covered by routine insurance, because 15 minutes is not enough time to go into all the things that are going wrong. And then, because I do a pretty intensive intake, it's a 90-minute intake, and there's a 150 something questionnaire that you have to do before coming on board. And the mindset has to be that you're looking to make a long-term lifestyle change. So this is not a quick fix. This is not anything that's it took you how long to get to this point. It's going to be longer than 3 months to get you out of it, right?
Right.
Because what I tell folks, lifestyle modifications are essentially things that you do slowly but consistently over time, so that it's not like a diet that you're going to come off of and go back to your old habits. It's something you can live with for the rest of your life. So we're looking at, longevity, and wanting people to be actually truly well,
I love that, the truly well part, and being able to have that time in that space to do the integrative part of your practice and really deal with the lifestyle medicine part of it. I know that you see it just like I do in my insurance-based practice, that there sometimes is so much that we want to do, and the time and space and constraints of insurance just doesn't allow it. And so I love that you have kind of another parallel practice there that allows you to be able to do those things. When we think about GYN visits, you made the distinction earlier that I love, that your pelvic exam, that visit for your pelvic exam annual or your GYN annual, should not be confused with your annual physical exam. You're going into your primary to get your annual physical exam. But that it really is, I mean, I tell my patients, I love the idea of if you've got a gynecologist that you see, go see your gynecologist once a year. Get that regular checkup done. It's a good time to talk about your hormone health. If there's a need for a pelvic exam to be done or pap smear to be done, that's the time to do it and the space to do it. But so many women tend to skip those, and they don't skip that GYN appointment because they're necessarily getting it done at their primary care office. They tend to just skip that pelvic health part altogether, and they say that they quote unquote feel fine. So let's both put on our prevention hats and tell us a little bit about why you feel like it's so important that women are having those regular kind of GYN pelvic health visits.
Well, so there's a couple of reasons. One, obviously, is the pap smear, but it's interesting because I've had a couple of patients recently who had not seen their gynecologist after they had their last baby. And their last baby was
and their
like
baby will be 25 years old.
Yeah, exactly. Right. So 10, 15 years ago. And they were like, well, I think I need to, or I'm busy taking care of all the kids and my husband, whatever. So their health takes a back seat. So they're not thinking about those things. And so, some of them think because they go to the primary care doc and they may get scheduled for their mammogram that they're good, right? I'm good. I'm not having no problems. My period's regular or, whatever. So, but it's really important because one, if anything changes, let's say with your lifestyle, let's say you get divorced or, you got married or you became a widow and now you got a new partner, all of those things, will play a role in your pelvic health. If you're having issues with repeat urinary tract infections or whatever, and you keep going to your primary care and you're just getting treated for that, you need to see a gynecologist to make sure there isn't a reason why, what is the reason? Because there is a reason. So what is the reason? We worry about if it's so long between, your prior PAP, we don't know what the results are. We can't get the results, then we don't know what's going on. And then of course there's if you are changing partners, then we need to do infection testing. So that's always a big thing, especially for my young folks who, don't want to get the pap smear, but need it done at least, and at least need some kind of yearly infection testing because of their single status and that kind of thing. So, but I will tell you that there are patients who, for those who are listening, if let's say you're younger, I know your audience is probably a little bit older and that's not an issue, but I will tell I've had a lot of patients who've gotten divorced recently, and the idea of going out into the dating world is daunting.
Yeah, it's a scary world out there, Dr. West. Trust me, it's scary.
Absolutely. So we need to make sure we're staying on top of those things so that you can feel comfortable living a single life, So, but yeah, I would definitely recommend folks show up, especially like I said, the pap smear is number one, but then there's everything else that could possibly be happening that you're maybe not even thinking about, that we'll ask you or will come out in discussion. I do more than just GYN care in my office. I feel like sometimes I'm mother, sister, cousin, friend, counselor, right? So there's a lot of conversations that I have, and we end up finding out other things, and then I'll refer them out to, therapists or whatever, because I think a lot of times that GYN visit, that's the only time that they feel safe or comfortable revealing some things, because it's already an intimate visit, right?
Right.
So if you ask them the right question, they may be willing to share some other things, and then like I said, we can get you straightened out and get you right on the right path.
Absolutely. I love that. And I love your mother, sister, cousin, auntie approach. And I'm so honored to have you here today, but I do not want you to leave without telling my audience about your podcast, because we talk about kind of all the things. I run the kind of scope of primary care on this podcast, but you are focusing heavy on gynecology and integrative medicine on yours. So tell us a little bit about the show.
So it's called the Integrative GYN. I'm currently on with Spotify and Apple Podcasts. And actually, we just did I dropped a podcast on January's Cervical Cancer Awareness Month.
Yes.
One of my good friends and colleagues is a gynecologic oncologist. So we had a nice conversation about, I think, a really informative conversation about cervical cancer and cervical health in general, and the HPV vaccine, and who should get it and who the risk factor, risk for cervical cancer. So that was pretty awesome. I've had another friend on who would talking about her breast cancer journey. And that was for October Breast Cancer Awareness Month, and then I did an introductory kind of podcast, just talking about what is integrative medicine and why I'm here talking about this stuff. So, and I'll tell you why. I have found, just by talking to so many women since I became GYN only, of course, all of my patients now are just GYN. So when I was doing OB, I wasn't focused. So now I'm super laser focused on, women and just GYN health in general. Not to say I don't care about my obstetrical patients. I can't live that lifestyle anymore. So it's a hard life for an obstetrician. But the GYN, I'm still laser focused on that. And what I found out as I'm seeing more and more of these patients all day, every day, is that one, either they weren't informed about anything, and they need a lot of education, or two, they've been told incorrect information, and they need to be kind of redirected. And I've educated, tried to anyway, through my course of my entire career. So that's kind of important for me. But I wanted to make sure that women knew that there's quality information. It's not Dr. Google.
Right.
I'm not going to tell you you're going to die at the end of the diagnoses, right? But there's also
what Dr. Google does.
Absolutely.
10 times out of 10.
Right. You get 20 diagnoses and the last one is death. Yeah. Right. It's always death. But no, I just want them to know that the information is actually out there. There are places to get actual care with a provider who is empathetic, who's sympathetic, compassionate, and wants to see you well. And that's me. Like, I truly want to see women get well and be in a healthier state, because I realized over the last probably, I'm going to say 10, maybe 15 years now, that women are sicker, and they're younger and sicker. And they need to know how to undo all of that and, like I said, get to a better state.
Yeah, absolutely. Dr. West, thank you so much for joining us today. I'm really excited about the Integrative GYN podcast. I remember when we talked about it, over a year ago, and you're planning for starting it. And I'm so excited to see that you started it. And ladies, please check it out. Available on Spotify and Apple Podcasts for sure. And I will link it in the show notes. So if you click on the link in the show notes, it'll take you right to the Integrative GYN podcast hosted by Dr. Whitney West. Dr. West, I like to, on the show, give our guests the last word. So whether your last word is about gynecological care, whether it's about integrative medicine, whether it's a Bible verse, whatever it is that you want to share, what's the last word that you'd like to give to our listeners today?
Listen to your female intuition. It's real. Listen to your body. And I dare say, don't take no for an answer. If you know something's wrong, please keep going, and you'll find the person that you're supposed to find who's going to help you get through whatever situation you're in, because we're out there.
Absolutely. We are out there. I love that so much, Dr. West. Your practices are in Madison, Alabama, so just on the other side of Huntsville. So ladies, if you are in Alabama, near Huntsville, near Madison, Alabama, go find Dr. West. Her gynecology only practice is Whitney West, MD, PC, and her integrative medical practice is called Essential Health and Wellness, PC. And I'll link both of those, the links for both of those practices, in the show notes as well. Dr. West, it has been an absolute pleasure to have you on the Headed to Healthier podcast. Thank you for what you do every day in caring for women and helping women lead healthier lives. And thank you for joining us here today. I wish you all the best in everything that you do.
Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.